My name is Sukriti Bansal, and I am presenting our poster entitled Characterization of Surgical Oncology Cases During the COVID-19 Pandemic. As everyone knows by now, the COVID-19 pandemic has had significant impact on the delivery of healthcare worldwide. In particular, surgery, anesthesia, emergency medicine, and intensive care services have been greatly impacted. At the beginning of the pandemic, numerous surgical societies released guidelines in order to aid with minimization of viral transmission, ensure appropriate resource allocation, and minimize perioperative complications during the delivery of surgical care. As a result of these guidelines, many non-urgent surgical cases were delayed during the pandemic. Our goal with this study was to characterize the impact of the pandemic and these guidelines on the delivery of surgical oncology care. We conducted a retrospective chart review at a large public hospital. Data collected included patient demographics, case volume, case urgency, and patient presentation. Data was collected for the time period of January 17th to May 8th, 2020, in order to include 8 weeks prior to and 8 weeks after the declaration of COVID-19 as a national emergency in the United States. For comparison, data for the same time period of January 17th to May 8th was collected for the year 2019. Analysis was conducted as a univariate analysis using an unpaired t-test. What we found that during 2020, there was a significant decrease in the number of surgical oncology cases conducted, as shown in the center graph. The black bar denotes the date on which COVID-19 was declared a national emergency in the United States. As you can see, there is a sharp decrease in the number of cases conducted after this date. We noted that the majority of this decrease resulted from a decrease in the number of urgent cases conducted, as can be seen in the graph on the bottom left hand. We also noted that there was a general trend to an increased patient presentation in the emergency room and inpatient settings. However, this patient presentation change was not statistically significant. COVID-19 has resulted in the postponement of surgical cases in order to minimize harm to the general population, as well as minimize perioperative complications. As a result of this, surgical oncologists have been placed in the difficult position of making the decision of which patients can safely proceed to non-operative neoadjuvant therapy and determine which patients require urgent operative care. As a result of these decisions, it is imperative that not only should surgical oncologists be involved in this decision making, but there should be strict and adequate follow-up of oncology patients. Thank you. Please let me know in the chat what questions you have.